Here we have a CTPA on a 50-year-old female with suspected pulmonary thromboembolism because of the pleuritic chest pain and shortness of breath. What we have got here is normal CTPA, but we have got abnormality in the right breast, as you can see here, on both axial as well as coronal slices. How to report these incidental breast lesions? The way I would describe the abnormality is as follows. I would describe it as a fairly well-defined ovoid-shaped homogeneous soft tissue slash low attenuation area in the right breast, measuring so and so, which needs further evaluation by the breast team. Based on the breast team review, further evaluation, including review and discussion in the breast MDT, is advised, and I would flag this report as urgent. So, in summary, here I have shown a case of an incidental breast mass on a CTPA, and I'm showing how to report and flag the report.